A new report from Joanne Chieti, the acting inspector general of the U.S. Department of Health and Human Services, describes the psychological and emotional trauma being suffered by migrant children in Trump administration custody at the southern border. One program director at one of the facilities that was studied by the inspector general said, quote, "Every single separated kid has been terrified." The report states some separated children expressed acute grief that caused them to cry inconsolably. The report quotes a medical director at one of the facilities. Physical symptoms felt by separated children are manifestations of their psychological pain. You get a lot of "my chest hurts," even though everything is fine medically. Children describe symptoms, "every heartbeat hurts," "I can't feel my heart," of emotional pain. And one of the program directors interviewed by the Inspector General gave this report. A 7 or 8-year-old boy was separated from his father without any explanation as to why the separation occurred. The child was under the delusion that his father had been killed and believed that he would also be killed. This child ultimately required emergency psychiatric care to address his mental health distress. Julia Ainsley has been covering this story for NBC News. She has been to the border repeatedly and has herself spoken to people in these facilities, and we are lucky to have her joining us now with her view of the Inspector General's report. Julia, it really is one of the painful documents to read about this story.
It is, Lawrence. And for some time, we heard from the American Pediatric Association warning about the long-term effects of separation, even if the separation was at max 2 weeks. And we know some went on for months as the government struggled to reunite these families. But this report really brings it home because you're able to hear through the mouths of the children and through the mental health workers who worked with them, the anguish that they were in. And they said some of the unaccompanied children who came on their own were teenagers. They also had mental health challenges, but it was those who were separated that were under so much distress because of their feelings of anxiety and abandonment, but also because they were so young. Many of the children who come on their own, like we said, are teenagers, but there were children who were under the age of 5 who were separated under zero tolerance, and sometimes they just didn't even have the words to say what they were going through. One mental health worker said the little ones don't know how to express what they are feeling. They described having chest pains, what you're describing there. And so this report, even though we're now over a year out from this policy, it really brings home the long-term damage that those 2 months had and really puts into perspective what is happening now as we see children who are held longer than they should in detention facilities, children who are taken apart from their grandmothers, their aunts and uncles, and some children who are still being separated from their parents for different reasons.
And Julia, this was written by Joanne Chieti. She is the acting inspector general. And it might be the only reason we have this report is that President Trump has never appointed anyone to be the inspector general of Health and Human Services. And so we've had holdover government employees there. And Joanne Chieti, as far as I could find out today, first went to work in government during the Clinton administration. And so she's worked her way up to this position to be able to do this. And it is a very thorough, very professional report, exactly the kind of oversight that you would expect from the department, especially on a program that for them is relatively novel on this scale, this level of detention and separation of families.
That's true. I mean, the report is remarkable in its level of detail. They went to 45 different facilities. There are 100 facilities like this across the country. Another thing they found, Lawrence, that I think is worth noting is that 6 of those 45 facilities that they dropped in on did not require background checks, either FBI fingerprinting or background checks required by Child Protective Services for the employees before they started. And I found that just to be a tragic coincidence, because when I was in Tornillo, Texas, right outside of El Paso last year, that we were in these tent facilities that were overcrowded with children. And HHS then said the reason we are so backed up is because of these very long process we have to follow in order to verify the identity of the parents that we're going to reunite these children with. They were requiring those parents to go through FBI fingerprint background checks, but not the employees who were taking care of the children in these facilities. So it was tragic to read that and to know that there were employees there who didn't have to go through a background check at all before being hired.
Julia Ainsley, thank you very much for your reporting on this and for joining us tonight on this important subject. Really appreciate it. Thanks for checking out our YouTube channel. Subscribe by clicking on the button below for more from The Last Word and the rest of MSNBC.